Let me now introduce our third speaker. This is, again, I apologize for my pronunciation. This is Zoltan Fezakas, an associate professor of business and politics with a focus on quantitative methods at the Department of International Economics, Government and Business, Copenhagen Business School. He has a PhD from the University of Vienna and has held visiting positions at Nuffield Mannheim Centre and the GESIS Leibniz Institute for Social Sciences. His research is at the intersection of political psychology, political communication, and comparative politics, and mostly applies quantitative text analysis and hierarchical models. So he's also published in top journals, including the American Journal of Political Science, the British Journal of Politics, Political Psychology, and the Journal of Communication. And we very much look forward to your presentation, Zoltan.
Thank you very much for the opportunity to present today. I hope you can see my slides. I'm not necessarily sure which device. Okay, sweet. So thank you for the excellent opportunity to present here. And I will be talking a bit more about school reopenings post-COVID-19 in Denmark, and we'll be presenting joint work with Jens Olau, my colleague, who's also on the call here. More precisely, I'm trying to move slides. Okay, more precisely, we're actually looking to assess the effects of post-COVID school reopenings on a variety of different outcomes. And we believe that this is quite important if we want to better understand kind of the long-term effects or the short-term effects of a lockdown if it happens again, but also it contributes a bit in terms of the discussions that we might have how to reopen the society, or how exactly are we kind of trying to find a balance in between public health and trying to reduce some issues related to some of these economic, political, and personal negative effects that have been already mentioned. So we'll be assessing this or parts of these trade-offs, looking at this staggered school reopening in Denmark, where there was a threshold in terms of who was allowed to go back to school. And we will be looking at this also as in terms of much of the public discourse here in Denmark has been looking at it as an experiment. Quite some people were very critical about this idea of treating kids almost as guinea pigs in the beginning. So we collected 2 waves of survey data from parents, and we will be looking at parental stress levels, economic outlook, and political support, but also child well-being in this particular setup. And we'll be looking at various comparisons in the future. So before that, I just quickly want to give you a glimpse of a timeline. So around mid-March, there was a closing in Denmark. So there was a lockdown. The schools have been closed. The announcement was made on the 11th of March, but technically you should close. The schools closed on the 16th of March, but already on the 12th and the 13th. People were encouraged not to bring their kids to school. So this is how it started. And then there was a partial reopening straight up after Easter. So this is Easter Tuesday. Some kids were allowed to go back to school. So daycares opened, and also some of the school children went back. So the threshold here was the 5th grade. So if you were in the 5th grade or below, you were welcome back to schools, but not for the older children, right? So this is what we call this staggered reopening or partial reopening. And then the situation kind of converged in when it comes to regular schools or lower secondary grades only later in mid-May, where everyone was allowed to go back. However, I already want to point out here, it's important to note that there were a lot of regulations how this reopening happened. So there was distancing kept within the schools, and so on. So obviously not each and every school opened the next day, and there was no full capacity opening if you wanted to keep the space as well. So in this period, first we interviewed around 1,300 parents right after Easter. So in the first week after Easter, which was in the first week of the partial reopening, and then returned kind of in the 3rd week of this partial reopening going, and around 1,000 parents decided to respond again. So the main criteria here was that the respondents had to have at least one child in the 4th, 5th, and then 6th or 7th grades in either of these. So since the 5th grade was this kind of threshold that creates some sort of a difference between different group of parents, we collected data from those who were below this threshold and slightly above this threshold, right? So if you had kids who were in the 6th grade, then they did not go back, whereas if you had kids in the 5th grade, they went back. But this allows us to do some more interesting comparisons where you have hopefully very similar parents, very similar children, and sometimes oftentimes even similar households. So before looking at some of these results, I also want to highlight that there is this very, very big disclaimer basket that I want to discuss, or at least point in this direction. So we need to be very careful if what do we learn from this experiment? It's obviously contingent on how the timing of the reopening, the timing basically of the lockdown. Where were we in terms of cases reported, where were we in terms of infection rates, and how's the healthcare system, which hopefully will come back as a point of discussion also based on the introduction. And the second part is there was very high compliance within the Danish society when it comes to the lockdowns. And there was quite high trust when it comes to the people who were implementing the lockdowns and then implementing some of the reopenings. But there was already a change in kind of the political consensus. There is a problem of endogeneity, or I will call it a problem of endogeneity. So obviously the success, no matter what sort of metrics we're using to evaluate this, but the success or the failure of a lockdown will kind of influence when and how the reopening policies will be either implemented or how successful they will be. And of course, again, there were a lot of school regulations. So while we're talking about reopening, so some kids were allowed to go back, probably this is still far from normality in terms of what was your experience prior to these lockdowns. And of course, in terms of data collection, we had some parallel changes. So some occupations were allowed to go back to work, and these are kind of short-term effects, and we never really ascertained when your child went back to school. So we just used the proxy of whether your child was allowed to go back to school. With this in mind, first I just want to review a couple of very simple differences. So we look at parents, we look at the first wave and the second wave, and we're just looking first at differences, and then I'll be highlighting the differences depending on whether you were in the group of parents whose children went back to school versus those who did not. So in the beginning, we looked at parental stress. These are 3 items from a short form depression anxiety scale. And what we see here is lower values mean less stress. And so that's good, I would assume. And the whole range would be between 0 and 1. So what we find is overall, there's a slight decrease in parental stress in between the 2 points that we measure this. So as we went along, there was decreasing amount of stress, which can be due to many different things. Now, if we look at these kind of differences, so here we can see that this is mostly something that you will find among the parents whose kids went back to school. And this is highlighted in the purple numbers in this slide. So this is also for the future. Basically, we're looking at the differences depending on whether your kids went back to school. That will be purple. So you had kids below the threshold, and then some of these differences and also the means are highlighted here for the comparison group, where your kids had to stay at home and still get additional homeschooling and caring. That will be reflected again in this green color. So what we found first is that there's a decrease in kind of the parental stress levels, and this is more pronounced if your kids went back to school. So another way to think about it, there's kind of this divergence between these 2 groups of people throughout the time that we're measuring what we're measuring. So the differences are getting a bit larger depending on whether your kids went back or not. And this is roughly, again, 3 weeks in the whole reform. Then we looked at economic outlook and work considerations. We asked parents how the corona crisis affected your household's economic situation, what % of your work you could actually carry out at home compared to a regular working week, and how concerned you are about your employment in the future, given the current conditions. And here on this plot, you will see that everything goes, basically the higher numbers are better outcomes or the positive outcomes. So you're more optimistic about the about your job, and you were able to carry out more work. And there's a bit of truncation in the figures, but just to have it here in one figure, all these three, we did that. So just because in the first economic well-being, you see kind of lower values, that's still middle of the scale. So pretty much in between, no big positive or no big negative influences. But what is the main takeaway point here is that we don't really find large differences. We find some kind of increase in the work capacity as we compare the first wave to the second wave. And again, this is slightly more pronounced when it comes to those who had their kids allowed to go back to school. So these are small differences, but slightly more pronounced for the parents who were, so to say, benefiting from the reopening that was going on. Now, the politics part is where we actually find differences, and this is quite interesting. We were looking at simply the prime minister's approval or kind of support, how they were doing, and then also the Danish health authorities. There were two institutions responsible, mostly as an administrative phase of the response to COVID, and they were oftentimes criticized also in the media. So we see that there is a decrease in support. That is both the case for the Prime Minister and also for the health authorities. And we can see that these are very similar patterns. So we all have these decreasing patterns. They're slightly more pronounced for those people who were not benefiting from the reopening, right? So if the kids were still at home, that is the group where we find a slightly larger decrease in between the two waves. But all of these are pointing in a direction that probably there might be some different mechanisms in terms of either politicization or approval or trust when it comes to comparing reopening versus just bringing in a lockdown. But we also need to know, note, of course, that there were very high levels of trust still, right? So all these authorities and the Prime Minister was very highly trusted. Now, when it comes to the child well-being, we asked parents to report on 3 different measures, and I'll just very quickly mention this, that we find very, very minor differences. So overall, first of all, between wave 1 and wave 2, these are very kind of small differences. Now, we don't find anything very specific when it comes to the kids who went back to school in terms of well-being, whether they feel relaxed or whether their parents think that they feel relaxed and how they're behaving. So this was not specific. There was no, nothing is masked if you went back to school or if you stayed at school. Given our data at hand, there is a slight decrease in how relaxed these kids were. But I mean, we started measuring this after Easter, which comes after an Easter weekend, which might already start quite high in terms of how relaxed the kids are perceived. But overall, we found very small differences here. Finally, we started looking into some exploratory differences between how mothers and fathers experience this, because obviously they might be quite large differences here. And I'll be using a different depiction here, but so if we see purple here, it means that kind of mothers were scoring lower, so they were worse off. And we can see that overall, that mothers in comparison to fathers were more stressed and had lower working capacity, but they were also more favorable towards the political entities that we have been looking at. And then we have some differences regarding to some of these economic well-being. Now, it's maybe more interesting to look at this as kind of a question of convergence or divergence again. And in a similar manner, what we see here is that there is an increase in the parental kind of well-being and work capacity for mothers. And this is a bit more specific actually for those mothers where the kids were able to go back to school. So again, this is for future considerations. We might want to consider who has the more difficult time and how some of these reopening strategies might have differential effects in this particular case. But when it comes to kind of the political support, then we see much more homogeneity across or between mothers and fathers. So again, with in mind with some of the limitations that I introduced, we find very small to no differences when it comes to child well-being. We find a decrease as reopening unfolds. There is kind of a decrease in parental stress, which is more pronounced for the mothers, and it's more pronounced in the case when you're actually benefiting from the reopening, in the sense that your kids are going back, which is very similar to to workload or how much work you can actually do at home. So these kind of overall differences that we're trying to look at and try to evaluate or assess what we saw in Denmark. But again, there is no explicit analysis of trade-offs. So if you look at the reports, in the beginning, there was an increase of the infection rate, which then tapered again, and then that's when the second wave of reopening or second phase of reopening happened as well. So it's important to put these results in context also in terms of how the lockdown was implemented, and you can find more detailed results in the report, or you can just get in touch with either of us. So this is kind of the initial contribution for this coming from some Danish survey data regarding the reopening.
Excellent, thank you so much, Zoltan. Again, very interesting findings indeed. For me, mostly the ones on the political attitudes. I found that very interesting. Maybe I'll ask you something later.